Hey everyone, it's Kristen here to do another quick video on a learning topic. And today's topic, we're going to be talking about what is the difference between ultrasound jelly and lubricating jelly. And why do we need to talk about the difference between that? Because hospital-wide, there's actually been a lot of people that are using this interchangeably. I've seen people try to use it interchangeably and usually stop them because they're not the same thing. I know that they look the same, but let's talk a little bit about the difference between them. Obviously, they're marketed for different things, but this isn't just a marketing scheme. There are some other chemical differences between the two, and we need to kind of know why we're using them. So lubricating jelly is designed to reduce the friction during a medical procedure and help keep the area moist. And ultrasound jelly is specifically formulated for the use in ultrasound imaging. It helps to conduct those sound waves, which is how we get our images through ultrasound, and tries to help give us some more accurate results. So let's talk about what it's made out of. So lubricating jelly is really made out of water. It's water-based. It has glycerin in it as well as some additional ingredients for moisturizing. While ultrasound gel, it's mainly water-based as well. However, it also has some propylene glycol in it and a thickening agent. And those kind of mixture of ingredients together are what are used to help to conduct those waves how we get our imaging. And it helps to reduce the amount of air that is in between the probe and the ultrasound gel to get us the best quality of picture. Consistency wise, you can kind of see this, how it's made differently because the lubricating gel is a little bit thinner and the ultrasound gel is a little bit more viscous, and it's going to stick a little bit more on the skin and make it so it's decreasing that amount of air that's happening in between the surface of the skin, the ultrasound gel, and the probe itself. So then the least amount of air as possible is going to increase that conductivity and get us the best image as possible. That's why if you were to use the lubricating gel, you may or may not be able to see things, but you're definitely not going to get the best image. It's not going to work as well. So that's why we really need to use it. When it talks about sterility, it does say on our lubricating gel, it does say that this is sterile. We know that. We use it when we're placing Foley catheters, use it in non-sterile procedures too, like NG tube placements. And when you look at your lubricating or your ultrasound gel, it doesn't say on here specifically that it is sterile, but what it does say is that it's bacteriostatic. So bacteria should not be growing in this, but the one thing we know is we've really switched to using single packets of ultrasound gel because using the same bottle over and over and over and over again is really not good when it comes to germs. Really not a great way to cut down on the germ process. So those are kind of the big differences between the two. So just if you are using them interchangeably, please don't, because you're really not getting your best ultrasound images, and that's really not what it's for. Lubricating gel is not for ultrasound gel. So that's kind of the takeaway of this message. So hope you learned something new, or hope you already knew that. Thanks.